Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. We're in top doc summer mode, folks. If you've been listening to this show, you know it'll take most of the summer to get to have you listen to the various guest speakers at the Freedom of Choice, not Freedom of Choice, but the Top Doc Conference, Top 20 Doctors, Alternative Doctors in America, out in Phoenix, Arizona a few weeks ago. You're going to enjoy listening to Dr. Mark Strr today. His information on thyroid disease, I'd never heard of it before. A book to back it up. How about this for a title? Heart Attacks, Heart Failure, and Diabetes, Prevention and Treatment. Now, it doesn't say it on the title, but it's all wrapped up with thyroid disease, and who knew? Anyway, Mark Strr, our guest today. Hope you enjoyed listening to him. I know I'll enjoy bringing him to allow you to listen to him. If in the course of our discussion with Dr. Strr, you want to call and ask a question or make a comment, you know the number. That's 412-825-6262. That's 412-825-6262. Now, the lineup keeps on advancing, so you got to pay attention around here. On Wednesday, Dr. Lee Cowden is going to be our guest, a board-certified cardiologist, going to be talking about cancer treatment. I did a heck of a presentation on it out there in Phoenix, and he's a very versatile doctor and can go all directions when it's necessary. Dr. Lee Cowden, our guest for Wednesday. On Thursday evening, don't miss it. Now, I'm going to be out there at the Freedom of Choice and Cancer Therapy Group. I'm the last speaker before summer break, and I'm going to look forward to seeing you out there to present to you something. I pulled it out a week or so ago, looked at it, and said, why not? The 7 deadly sins of conventional medicine keep going on. They get more deadlier as day goes on. Anyway, we're going to revisit the 7 deadly sins as well as present the most up-to-date and unique therapies available in the country, all on Thursday night this week. So looking forward to see you out there at Riverside Landings. That's on Thursday evening, 7 o'clock, Riverside Landings in Oakmont. Come on out, and I'll enjoy spending an evening with you. Now, we got other guests coming up this month. We've got, but I should mention, Dr. Jimmy Barber, who was supposed to be our guest on Friday, a plastic surgeon here locally in Pittsburgh, had an emergency case to do on Friday morning. You know how that is. So we talked on the telephone, and we're going to reschedule him. Probably doesn't look like we're going to be able to till the month of July, but that's just around the corner anyway. I promised to bring you Dr. Jimmy Barber talking about cancer predisposition screening with a new form of testing, and even this form of testing covered by your insurances. Then on the 23rd, we're going to have Dr. Bruce Shelton with us, one of the 20 top docs of America, talking about homeopathy and his unique series remedies that he developed with a company called DesBio. David Steenbach on the 25th, talking about stem cells, the bad boy of medicine out there on the West Coast, gets involved in more brouhahas, but this man is a stalwart in alternative medicine and has been so for the last 30 years. On the 27th, we're going to have a presentation from a company called Beresha, a unique company positioning itself in the weight loss realm that I think, whenever I come across one of a kind, I like to bring it to you. I'll bring you the Beresha story on the 27th with Dr. Angelo Mistos, a podiatrist from the Newcastle area. That'll be our guest on the 27th. And on the 30th, Susie Weiss is going to be our guest because, of course, she's going to be coming in that week, July 3rd, for her free seminar here in the office. Now, look, Susie usually comes on the same week that she does her scans, too, and because we have so many top docs, we weren't able to bring her to you today. But for those of you who'd like to get scanned. You know what the Zyto scan is? Susie keeps talking about it when she comes on the show. You can give Susie a call so that she can schedule you for this Thursday in my office. Now, here's the number, 740-632-5159. That's 740-632-5159. Give Susie a call. She can schedule you for one of those Zyto scans. It's about a 30 or 40-minute interrogation, really, utilizing electronics and the like. It's a neat test. And then don't forget Susie, our guest on the 30th, in my office for the free seminar on July 3rd. Flipping the month as I have, just looking into the future in July. Got Dr. Nicholas Meyer, one of the top docs. There'll be others. I got to get on the schedule because we're quickly moving through June, and I got to load up July. I promise I will do so. Going to mention too this new product line called Neo 40. If you've got hypertension in your realm and you're on various blood pressure medicines, this new way of correcting blood pressure without the use of medicines, I think I launched it here and had a discussion on it on Friday. The name of the product is called Neo 40. It is a way to generate nitric oxide in a way that really works. It was developed by Nathan Bryan and a company called Neogenesis, and the product is available online. Now, you can go to my website at Pittsburgh Eye Protocol. All my products that I back are on the product section of PittsburghEyeProtocol.com. But if you're looking to try to get a hold of this stuff and you can't find it, Neo 40 is available on my website. Also, the testing sticks are available too. So go right to the website. You can do it directly online and not have to worry about even leaving your house in order to make sure you're supplied with Neo 40. We'll be talking about it more, and if you're coming to see me for any of the consultations that I'll be giving, it'll be front and center on one of the things I address to you and with you. And we'll let it go at that. All right, folks, let's take a short break. In the interim, we're going to find our Dr. Mark Strr. You're going to learn some things about heart attacks, failure, and diabetes you just never knew before. I know I didn't, and that's why I'm bringing Dr. Mark Strr to you. Be back in a moment with Dr. Strr.
You become confused about how best to...
Okay, give me a few seconds. You can talk to him.
Okay.
Television or radio.
Hello, Mark.
Hey, how are you?
I'm doing well, Mark. It's an ungodly hour. Is everything okay with you at this hour of the morning out there in Phoenix?
Yeah, I had a couple cups of coffee before I left my home at 4 o'clock or 4:15, whenever it was.
I know it's a burden, and thank you so much for allowing us to come aboard this morning with you. Do a brief introduction. I sort of was fanning through this, and as far as some logical progressions in terms of actually, as we move through the pages, talking about the thyroid in general, myxedema, we're going to talk about that. Pathognomonic. Anytime I hear the word pathognomonic, I bristle, and the listener needs to know about it too. Then the Broder Barnes and all those autopsies that he was involved with. I think we'll be able to cover this topic quite nicely in these little blocks and little steps, if you let me guide you through it, okay?
Sure. Yeah, and if I start, I can go on and on. You know, you ask me one question, and 5 minutes later I go, what was that question?
I'll keep you on target. So get ready. We're going to be coming aboard in just a moment. Intro you, and then we'll be off to the races.
Sounds good.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Right here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9. I'm Dr. Dennis Courtney with you today, and this post-father, I hope your weekend was a wonderful one. Dads out there, I know mine was. This is a post-Father's Day show in keeping with our summer pledge of bringing you the top alternative doctors in America. Conference held out in Phoenix, Arizona not too long ago brought a number of some of the best doctors in the world into one venue at one time. I had a chance to meet them all. I was waiting on the side of the stage to ask them if they wouldn't mind coming aboard and meeting you, the Pittsburgh audience. Each and every one actually did say they'd do it. Today, you're going to enjoy our guest. His name is Dr. Mark Strr. He's a diplomat of the American Board of Pain Medicine and is licensed by the Arizona State Board of Homeopathic and Integrative Medical Examiners. He has studied with President Kennedy's famous pain specialist, Hans Kraus, MD, and Lawrence Sonkin, PhD, MD, renowned endocrinologist at the New York Hospital Cornell Medical Center. Mark Strr has become known as the thyroid expert. His book, Hypothyroidism Type 2, is well known in the industry. And now this new tome, get a load of this, folks. Heart attacks, heart failure, and diabetes, prevention and treatment. The man who ought to know is with us now. Let's say good morning and welcome aboard, Dr. Mark Strr. Thanks for allowing us to invade your early morning out there in Phoenix, Arizona.
Good morning to you, too. I'm happy to be here on your show.
Well, Dr. Strr, I want to start out. It's a passage right out of your book, but I think it will set the groundwork for interesting discussions. This appears on Roman numeral 9. Let me just read this couple of sentences. The cause of heart attacks and how to prevent them from occurring was conclusively established when Broda Barnes, MD, PhD, endocrinologist, published his book entitled Solved, The Riddle of Heart Attacks in 1976. His research proved that hypothyroidism was the underlying cause of heart attacks, and proper treatment for hypothyroidism prevented heart attacks. Dr. Barnes' book is now out of print, but copies remain available. Now, Dr. Strr, I asked to start with that passage because I got to tell you this. I didn't get the memo. Somehow, this avoided me in all of my medical training, and I don't know if it avoided you, but to think that something had been solved and I didn't know about it and never heard about it was a very amazing revelation to me. And you brought that to me out in Phoenix, Arizona. So if this is so well known by Dr. Broda Barnes, why isn't it so well known to us?
Well, that's the premise of my whole book, is that it's all about the money, because they don't teach any of Dr. Barnes' research, and it was voluminous to any formal medical training program. So I had an interview not too long ago with another thyroid person who has their own website, and they said, what about the Hippocratic Oath? And I said, well, it has nothing to do with the Hippocratic Oath, because they don't teach the doctors that, and how are they supposed to know when they aren't taught? And it has everything to do with money, because medical treatments are by far the most lucrative business on our planet. And for instance, in the United States, the gross domestic production is 18%. 18% of our GDP goes toward healthcare, and that dwarfs, for instance, our military, which is 4.4%. And the big insurance companies and pharmaceutical companies want to keep the status quo and have five lobbyists per representative in the Congress.
Yeah, I heard that. Sure.
And they do everything they can to maintain the status quo, and you can't be solving number one killer on our planet with simple desiccated thyroid, or thyroid in general. So there's a research foundation. Dr. Barnes did, he was a MD, PhD endocrinologist who began his teaching at the University of Chicago in 1930. And he became a PhD in endocrinology, and in 1937 he became an MD. He did research on people and animals for the rest of his life. He did 70,000 consecutive autopsy reviews over in Austria, and he knew that accelerated hardening of the arteries and susceptibility to infection were the hallmarks of low thyroid. And he was not having any thyroid, heart attacks in his patient population when he began his own clinic, and they were exploding in the 1940s in frequency. So you go ahead and ask me some more questions. Anyway, he prevented over 90% of heart attacks in a 20-year study. He should have had 74 according to the American average, and he had 4. And 30 people who quit the study had fatal heart attacks within 6 years. So it was quite profound and hardcore data. He has a research foundation in his name. He died in the 1980s, in his 80s, and it's called the Broda, B-R-O-D-A, Barnes, B-A-R-N-E-S.org. You can still get that All the Riddle of Heart Attack books. It's out of print, but they have basically Xerox copies. They're available for about $30, I think.
I'm going to absolutely get one of them now. This is as I say, I didn't get the memo on this one, and you're right about the money issue when it comes to American medicine. As I go through your book, trying to lay the groundwork for this, every so often you have a bold statement to make, and we're going to start out with a couple bold ones that I think lays very good groundwork for getting to the heart attack issue. How about this one? You say, of all your hormones, the thyroid is the most important. Can you tell us why?
Sure. Well, you don't have proper thyroid. Thyroid controls your metabolism, the speed and efficiency at which each and every cell in our body functions. If you have low thyroid, waste products accumulate and your body doesn't work very well. Every cell doesn't work very well. So none of the other hormones can function properly without the thyroid. The thyroid is the kingpin. If you're born without thyroid function, you're a mentally retarded, called a cretin, C-R-E-T-I-N. There were lots and lots of cretins in Austria, where Dr. Barnes did his 70,000 autopsies, and so the sex glands don't develop, and then without the thyroid, it's by far the most important in the body.
Now, certainly can understand that the metabolic rate being influenced by thyroid hormone is the reason why there's not one single zip code in the body that avoids the influence of thyroid hormone. That's why the symptoms that go along with thyroid disease are so varied. I mean, it spans every organ and every function of the body. There's one in particular, however, that I think my listeners need to become acquainted with, and that's this production of mucin and the accumulation of mucin that moves into something, a big word in medicine, but I know to you and I, it means everything when something is pathognomonic. Could you talk about mucin, myxedema, which is a funny word maybe to our listeners, and the word pathognomonic, because to me, in medicine, that says it all.
Right. Well, my wonderful teacher in New York, Dr. Sonkin, the MD, PhD endocrinologist I studied with and was treated, knew that the thyroid blood test didn't work very well. And he had been treating thousands of patients before they came up with the TSH blood test, which is what doctors use to diagnose and treat hypothyroidism, for 40 years. And he taught me, or rather he treated me despite the fact I had normal blood tests. And he also told me that there were millions of people who were low thyroid who the blood tests weren't picking up. And after I was going to stay in New York to study with him and Dr. Krause for 6 weeks, and I ended up staying 2 years. And after that, I moved back to Missouri and opened up my pain clinic, realized that most of my patients had hypothyroidism, who had chronic pain. By the way, if you treat thyroid properly, 2/3 of joint and muscle pain goes away. The vast majority of headaches and migraines also go away. So Dr. Krause worked very closely with Dr. Sonkin. Dr. Krause was the pain doctor and orthopedic surgeon who was 90 years old when he was treating me in 1995, working 2 days a week, and died the next year after I left. But those wonderful doctors collaborated because they knew hormone problems and pain were integrally related. And when I started my pain clinic, it took me about 2 years to realize most of my pain patients had hypothyroidism, and I could not talk any of the medical doctors I was friends with or associated with into giving my pain patients the thyroid hormones they needed because their blood tests were normal. And I did research back into the 19th century when the thyroid problem was discovered, and the medical term for hypothyroidism is myxedema. Mix is the Greek word for mucin. Mucin is a normal constituent of our connective tissues, and it accumulates in abnormal amounts when you're low thyroid, and about half of the patients, half don't have the myxedema. But yes, one of the profound pieces of research I found was the fact that the old medical textbooks said that if you do have myxedema, it's thyroprival and pathognomonic, meaning it's distinctive of hypothyroidism, and if you have it, you definitely are hypothyroid.
Yeah, that word pathognomonic.
Ask me some more questions.
Yeah, that word pathognomonic says it all, and I wanted my listeners to appreciate that this myxedema, or this swelling of tissues, is something that I believe goes unnoticed by many, certainly by many doctors, and it's a shame. But this accumulation of fluid looks to me to be the underlying mechanism. Besides the metabolic rate that gets knocked down, it's this accumulation of this mucin that leads to all sorts of problems, one of which is going to be the very heart attacks that we're going to be talking about in a moment. Isn't that the way? Am I reading this correctly, Doctor?
Well, Dr. Barnes, who did the heart attack research, knew that two of the hallmarks of low thyroid were susceptibility to infection and accelerated hardening the arteries. The first cure was 1891, and the first before treatment and after treatment pictures were in the early 1900s, and they are on my website. You can see before treatment and after treatment pictures how profoundly you can change people's appearances. The last medical textbook I could find that had before treatment and after treatment pictures was 1957. The fellow was president of the American Endocrine Society, and his pictures are in my books and my website as well. So if you want to see before treatment and after treatment pictures, I would highly recommend my website and my book.
Why don't we just take a moment? In fact, I've got your book in my hand, and I'm looking at the very pictures that you showed me the slides when I was out in Phoenix, but nonetheless, to have a copy of these, they are night and day before and after treatments, and how people's facial structures change when the myxedema is solved. They got these chubby little bloated faces always, and then after they're treated correctly, that goes away. And I would like for you to let my listeners know, number one, what your website is, and number two, how they could get a copy of this book.
Sure. Well, so the website is 21, Century, CENTURY, med.com. And the easiest way is just to click on my website and buy the book through there. If they'd rather go through Amazon, that's fine with me as well. It's an ebook, and it's also printed. So if you, I think both printed and ebooks are available through Amazon. And the pictures, a lot of the pictures are on my website, not all of them. But most of the pictures are in the first book as well as the second book. And both books are available on my website as well as Amazon.
I'm going to encourage all my listeners, at least go to the website. You got to see these pictures. Myxedema will resonate with you listeners the moment you see these before and after pictures. I'm returning to the symptoms associated with thyroid disease, and although I know it's an exercise that even my listeners would be comfortable with, you know, these symptoms are the bread and butter symptoms I've been looking at for years: fatigue, weakness, cold intolerance, muscle pains, headaches, migraines, constipation, dental problems. There's fertility issues, menstrual. That all hit the memo. But you have these bold type passages once again, and you mentioned this already a moment ago, but I'm going to bring it back because you said that a cornerstone of Dr. Broda Barnes' work is this: susceptibility to infection and accelerated atherosclerosis are the hallmarks. Now, that's a completely different statement. They're the hallmarks of hypothyroidism. And to him, evidently, he made that connection really clear, and that's the memo that didn't make it to me. How did we miss it?
Well, it's not taught. That's how we missed it. They don't teach us that. That's why I became my first editor, I think, said it best, which is medicine is like a fundamental religion. And if you stray from the doctrine, you're a heretic. And I became a heretic in Columbia, Missouri when I had a pain clinic. And they used to, before this blood test, it doesn't work, the TSH, they used to do something called the basal metabolism testing. And when the doctors were getting mad at me, I had a wonderful PhD physiologist who was in charge of the heart rehab program at Boone Hospital in Columbia, Missouri, and I sent 50 patients in a row who had normal blood tests to check out what their metabolism was, and they averaged 14% below normal. One of the patients was 48% below normal, so half dead, basically, with normal blood tests. But it didn't matter how well the patients did, how well my pain patients did. The only thing that mattered was the fact I was treating patients and not treating the blood test. And treating blood tests instead of patients has been a total disaster. But it's not just in America, it's in Canada, and I lectured in Sweden, and it's in Sweden. If you don't abide by the dictum to treat blood tests instead of patients, then you can lose your medical license.
Get out. Really?
Yeah, one of the top reasons why doctors lose their license in this country is for treating thyroid, like I say in my book. And
well, we're going to go to jail. I'm going to jail. I can tell you that, but we would never use.
Did the first comprehensive report on hypothyroidism, which is medical term for the medical term is myxedema. So the quote was, "The general uniformity of the more prominent symptoms is indeed remarkable, allowing ready recognition of the malady in any freshly encountered case by an observer who has seen one well-pronounced case." So those are the before and after treatment pictures. You don't need to do a blood test. You can look at people and tell when they're low.
Oh, it is so obvious, so blatantly obvious.
Yeah, and when the metabolism is low and you're hypothyroid, your basal temperature, the temperature under your arm when you first wake up in the morning, is also low. And that Dr. Barnes published that in 1942 in the Journal of the American Medical Association. How the basal temperature was more accurate than the basal metabolism. And so that's another way you can tell if you're low thyroid. You put a thermometer underneath your armpit when you first wake up in the morning. Basal means resting. And it's supposed to be 97.8 to 98.2. You'll be surprised how many people have low temperatures and low metabolism. Dr. Barnes said in 1976, when he published one of his last books, Hypothyroidism, the Unsuspected Illness, that half of Americans, men, women, and children, were low thyroid. So it's a huge problem. And we can go on to the symptoms now, but I wanted to cover that little tidbit before we did.
All right. Oh, here's what I'd like to go into. You mentioned it a couple times already, and there appears to be not just a fascination, but a reliance on post-mortem assessments. And this brings up this interesting situation in Graz, Austria, and then a remarkable number of autopsies are done. Share with my listeners the unique story of Graz and how that weighed into Dr. Barnes's assessments of the cardiovascular issues and so many others that he was able to pick up on that we didn't get the memo for. What about Graz? What are they doing over there?
Well, Marie Antoinette's mother, Queen Maria Theresa, was a renowned monarch, ruler of Graz in the 1700s. Graz happened to be one of the more hypothyroid places on our planet. Sure, they had no iodine, which is important when you're with a thyroid. And something like over 90% of the babies were dying at birth, and one of every 100 people were cretins. And Dr. Barnes found out after doing tons of research, he was doing research from 1930. He found out in 1957 the American Medical Association in Vienna, Austria, had a big following, and also found out that Queen Maria Theresa had mandated autopsies, everybody dying in Austria's second largest city, Graz, from the late 1700s. So he went over there for, I think it was 1958 into the early 1970s, and studied with a pathologist in Graz who was in charge of all the autopsy studies and reviewed 70,000.
70,000.
What brought us out of the bleeding for 14 centuries. We used to do bloodletting for 1,400 years, and it was the autopsies that correlated symptoms and pathological findings under the microscope and so on that brought us into the modern medicine. So they're the gold standard of doctors for 100 years. Would if someone died, they do an autopsy on them, their own patient, and try to figure out why they died. And so Dr. Barnes found out there was this huge wealth of autopsies in Austria, and went over there to prove his assumption that heart attacks were caused from low thyroid. Sure enough, the rate of heart attacks went up over 900% after antibiotics and antituberculin drugs were introduced in 1945. So before that, in the 1930s, when he was in medical school, the late 30s, he said there was hardly anything about heart attacks because they were rare. For thousands of years, people died from tuberculosis, smallpox, plague, infections in large numbers.
They didn't get to live long enough to die from something else. Wouldn't that be a fairly good statement there?
That's exactly right. So for thousands of years, we weeded out the low thyroid population who were susceptible to infection. And the autopsy showed once the antibiotics and antituberculin drugs were introduced, the heart attacks went right through the roof. They became epidemic within 3 or 4 years after the introduction of antibiotics and antituberculin drugs.
Because they now could live long enough to actualize that which was hidden because they were dying off like flies from these plagues and these infections. So, I mean, it does sort of make such sense that it was masked, it was covered over. We never got to the heart attack issue. But when he finally took a look at the people in the 1900s and 1930, compared them to 1970, the drastic change was so obvious at that point. Wouldn't you agree?
No, it was obvious to Dr. Barnes. You know, by the 1950s, nobody was having heart attacks, and the rest of the population, it was becoming epidemic in a big hurry. And it turns out during the war, World War II, that was one of the reasons they came up with this cholesterol theory, because the heart attacks went straight down in the countries who couldn't get a hold of eggs and butter and animal fats and so on and so forth. So heart attacks dropped like a rock during the war, and turns out the autopsy showed that the patients who died during the war died from infections, mostly tuberculosis, which is why they didn't have heart attacks during the war. Turns out that the hardening of the arteries quadrupled when they weren't able to get their animal fats and eggs and so on. And they were stressed out, and their immune systems were impaired. So all the patients who died of tuberculosis during the war years had severe atherosclerosis in their arteries. And after antibiotics and antituberculin drugs were introduced, all the patients who were dying after the war years, guess what? Every single one of them had tuberculosis in their lungs. So that was a profound research finding, with his autopsy studies. So the low cholesterol stuff quadruples your rate of atherosclerosis. It doesn't help anything. And as a matter of fact, for the first half of the 20th century, if you had high cholesterol, that was diagnostic of low thyroid. And yes, I had most of these things myself. And luckily, when I was in medical school, I was in my 30s, I had normal triglycerides and normal cholesterol, and I had a great diet and exercised every day. I was a swimmer. But by the time I was in my 40s, in my early 40s, I was getting sick. My triglycerides and cholesterol went straight through the roof. no change in diet, no change in exercise. And thank goodness I got to Dr. Sonkin, who measured everybody's triglycerides and cholesterol. And in my research, there were some doctors who proposed that they use the elevated cholesterol to diagnose hypothyroidism in the first half of the 20th century. And 95% of the patients who had high cholesterol and triglycerides, like I did, would normalize on just the thyroid hormone. So not only that, their fatigue would be decreased from 90% to 26%, cold intolerance from 80% to 23%, joint and muscle pain down by 2/3, depression by 2/3, which is much better than any antidepressant was ever shown to the efficacy. Constipation, headaches down by 3/4, and migraines. So besides getting rid of your high cholesterol and triglycerides, you get rid of a whole mess of rot, as Dr. Barnes said. And you can still get his lectures. I highly recommend them through the Research Foundation, brodabarnes.org. He gave 2.5 hours of lectures in the 1970s when he was in his 70s. This summarizes his lifetime's worth of research. They should be teaching those lectures and his research to everybody on the planet who touches a patient. But of course they don't.
Could you, because I see clearly where statistically they show such a mountain's worth of evidence that the numbers of people that die from heart attacks are through the roof now, and of course when infections were finally treated, it allowed the real display of thyroid disease, which is this relationship to atherosclerosis, to finally shine through, and it's in full bloom today. Boy, it is absolutely a skyrocketed set of pathologies that we confront every day. Could you, because I'd love to hear it from you, could you elaborate the pathological mechanism for how, one thing is the numbers, they're through the roof, but tell me how it is that if you have a low thyroid, you end up having atherosclerosis as one of the common things that you're going to find? I mean, what's the mechanism of how that occurs? Or is there no mechanism, it just is a thing that happens?
They first started doing thyroid research back in the late 1800s, and every animal whose thyroid they took out had accelerated hardening of the arteries and lowered immune function, so they were susceptible to infections. They lost their hair, and they became quite sick. And not only that, they didn't have a cure till 1891, so they had a lot of autopsy studies. And a lot of the autopsies, for instance, were kidney failure, just like the diabetic patients, and atherosclerosis. Anyway, Dr. Barnes thought it was the infection that caused all the inflammation, damage to the arteries. And when they would give these animals as well as people back, the hardening of the arteries stopped. So that's how he was able to prevent over 90% of heart attacks. And luckily, when I was in my pain clinic in 1996, one of my doctor friends knew I was basically doing a lot of research on thyroid, and he found Dr. Barnes' book, which is still available, called Hypothyroidism, the Unsuspected Illness. And let's see. So anyway, I learned Dr. Barnes' research, and all 4 patients who had heart attacks in his 20-year study were on the minimum dosage required to restore these people to their health. Minimum dosage was 2 grains. Grains are how they measure gunpowder, and then that was around the 1900s when that was, in the 1800s when the grains, so the desiccated thyroid is dried pig thyroid glands. The Armour Meat Company used to produce all the desiccated thyroid in the country, and it's a glandular thyroid. Pigs are quite genetically similar to humans, and it works quite well. And dosages range from 2 grains to 5 grains. And all 4 patients who had heart attacks were only on 2 grains. So for the last 15 years, my goal has been to increase my patients more than 2 grains. And that's a big no-no because the blood tests show you're on too much. But I've done it anyway, and my patients have done so well that I've only had 1 patient on more than 2 grains have a heart attack. He had 4 stents in his coronaries when he came to see me. He was still smoking cigars and had a bunch of rotten teeth. And he managed to have a heart attack in the hospital when he was having shortness of breath and chest discomfort. So we only missed a couple of weeks worth of work. So in 15 years, that's the only patient who's had a heart attack. He was on more than 2 grains. I had several patients have heart attacks when they were starting a thyroid, because when you start the thyroid, it makes the heart beat much more forcefully, and the heart needs more blood when it beats more forcefully. So you have to be extremely careful with older folks who've been low thyroid most of their lives and have bad teeth, because dental infections are another one of the primary things that cause hardening of the arteries and damage to the arteries. Dental infections, the toxins from the dental infections go everywhere. So I mentioned that in my new book as well.
Well, that issue of infections then is primordial. That is the common pathological setup that takes you from just infections to every other thing. It's the immune system compromise leading to infections, which lead to atherosclerosis. It's sort of a triad there. Do I have that right?
Yes.
That is a
and
perfect.
Dr. Barnes published data, and I have seen it time and time again, that once these patients come in, they're so susceptible to urinary tract infections and upper respiratory infections, so on and so forth, sinus. So once they're on plenty of thyroid, it may take a year or 2 before they stop having infections completely, but they're usually better within 6 months. And I have all that as documented in my books and Dr. Barnes' books. They're very well referenced, meaning any doctor that wants to look at the research can do so. So his books and my books are extremely well referenced.
All right, and I want to mention to my listeners again, head to your website at 21centurymed.com. You say we can buy the books there, and certainly have a whole host of your ratings and everything else available on that website. I want to move along. Our time is moving along too, and switch just some gears here and move from the heart attacks, which I think you clearly now associated with hypothyroidism, to another cardiovascular problem, which is congestive heart failure. And I'll let you segue into that, because clearly now there's a relationship between thyroid disease and heart failure. How so? How does that occur?
Well, I can tell you it involves something called mitochondria, which is they're little tiny energy factories that are either hundreds or thousands in each one of our cells. All trillion cells have mitochondria in them. And the thyroid both increases the number and size of the mitochondria, and the heart is 1/3 of the weight of the heart is mitochondria. And you can think of mitochondria as the same thing as hypothyroid, in my opinion, and all that is in my first book. I didn't put it in my second book because the first book is close to 400 pages. The new ebook is about 68 pages, and then additional references and so on. But so the first cure of congestive heart failure was 1918. Hermann Zondek, and I read a lot about Dr. Zondek. He was the #1 guy at the biggest hospital in Berlin. In the 1920s, he was the first doctor to write a textbook on endocrinology, and the X-rays, they were called röntgenograms. Röntgen invented the X-ray. So in 1918, I have his X-rays in my new book. There was a wonderful cure involving the X-rays showing how the heart shrinks back down to normal size. In the 1920s, Dr. Farr from the University of Minnesota, beautiful. They had the patient in the hospital for a year. They shrunk the heart to normal, then they took the thyroid away and let it get big again, and then they shrunk it again. And of course, you could do that in the 1920s just to prove that it was the thyroid that was resolving congestive heart failure. And I liked the quote that I found in that study. I spent 5.5 years researching old textbooks because none of this stuff is in the modern textbooks. It's gone. And the radiologist, or the röntgenologist, that's what it was, the röntgenologist in the 1920s, diagnosed the second and third cases just by looking at the X-ray. So a heart dilated greatly in all chambers is called the myxedema, the other word for hypothyroid in the medical term, the myxedema heart. So that was in the 1920s. The last textbook I could find before treatment and after treatment x-rays and pictures and case studies was by a gentleman, Dr. Lisser, and his colleague, Dr. Escamilla. They were endocrinologists at the University of California, San Francisco their entire careers. And Dr. Escamilla's daughter has all the copyrights, the textbook, and that's just a gem of a textbook. And all the doctors should be reading that one as well. So 1957, the president of the American Endocrine Society not only reversed heart failure, and the x-rays show that, but also got rid of all the fluid in this lady's belly called ascites, and normalized a whole host of thyroid symptoms. And so none of my patients who've been on a therapeutic dose of thyroid have ever had congestive heart failure. Did have a lady after I finished this book who's 87, a mouthful of metal and root canals, and she does have congestive heart failure. So I tell all my patients, no matter how good a doctor I am, everybody's going to die. So she's the only person in my 15 years of using thyroid properly who's had congestive heart failure. So there's that.
But there's that mouthful of dental issues with a lot of infections. So where are you gonna go if that doesn't get cleared up? You just can't. You can't.
So let's go on to diabetes. Huh?
Yeah, we're coming around that home stretch. Make the connection. You've done it very well now with atherosclerosis and heart attacks. You've done it equally well with congestive heart failure. Now make that connection to the diabetic between that and hypothyroidism.
Well, once again, I have to give Dr. Barnes credit, and my book is dedicated to the Research Society, brodabarnes.org. And he had this long-term study, and there were a number of diabetics, I think 80-some, who came into the study on heart attacks. Not only did they not have heart attacks, but they didn't have any complications like blindness, gangrene, kidney failure, none of that. One older lady had a mild heart attack. That was the only complication he had in over 20 years, almost 1,600 patients. And all of the complications, or at least 90+% of the complications caused from diabetes, from the blindness to the kidney failure to the heart attacks, are all due to accelerated hardening of the arteries. And when Dr. Barnes realized that none of his patients, it took him about almost 20 years to realize, my gosh, none of my diabetic patients have had any complications, he went and rummaged through all the old textbooks, just like I did, and found a study from 1954. Dr. Crosby Eaton had published a study in the Michigan Medical Journal saying that complications of diabetes were greatly reduced when using thyroid properly, which is a big dose of desiccated thyroid for most. And so Dr. Barnes was the first. Well, he wasn't the first, he was the second. And his publication in 1976, the Hypothyroidism, the Unsuspected Illness book, is a chapter on diabetes. And so I've had a number of patients enter my practice with diabetes. Actually had 2 or 3 patients when they were just starting a thyroid develop type 2 diabetes. So my goal, once again, was have my patients on more than 2 grains. And unfortunately, for most of our population, that means their blood tests are going to show they're on too much. Doctors won't give that much, but they should be. So we can prevent all the complications of diabetes, and not only have my diabetic patients not had any additional complications other than what they came with, I have not had any heart attacks in my diabetic patient population as well. So 1 patient on more than 2 grains developed a type 2 diabetes. Once again, it was right when I was finishing my book. I had none the first 14+ years. And he had rheumatoid arthritis and autoimmune thyroid problems called Hashimoto's. And also still had his root canals, and I'd been treating him, and he was doing pretty darn well. But he did develop type 2 diabetes. Yeah, he's the only one. So it's quite profound. You can stop that hardening of the artery stuff just like you can with people that get heart attacks using thyroid properly.
Limit the complications from diabetes. Just amazing work, Doctor. The Berta Barnes Society, or the Berta Barnes legacy, lives on because of guys like you. There aren't many who've picked up the stanchion and keep carrying it down to the other goal line, and I got to commend you for stumbling across this. I don't know if it was a stumble or if you were directed to do it, but you're doing a heck of a job and letting Berta Barnes' work come through and shining the bright light upon it. You mentioned, and I think that as we come into the gun lap here, appropriate treatment of thyroid, you feel, if you're going to use the Armor/Nature Thyroid combination of which is a pig-derived desiccated gland, that you say should be around 3 grains. Did I get that right when I was out in Phoenix? Did I hear you right?
Yes, the average adult dose in Dr. Barnes' studies was 3 to 3.5 grains. It depends on the size of your body.
Mm-hmm.
Children don't need, just need a fraction of that. 300-pounders need the 5 grains or 6. But you have to be careful. Anybody with autoimmune thyroid problems like Hashimoto's, and I found that a lot of my patients, thyroid patients, have severe allergies. They frequently do better on compounded T4 and T3. Berta Barnes said that in his lectures, 2.5 hours of lectures. I mentioned that if you have Hashimoto's, you have to be on the synthetics. The synthetics are T4 and T3. There are 4 types of thyroid hormones, according to however many molecules of iodine. So the middle of the thyroid hormone is called tyrosine, and then there are 4 iodine molecules, and it converts to T3. Anyway, the main reason why the TSH doesn't work, we have learned 2 years ago, but it has not been in any endocrinology textbook, but references are in my book as well, is that the pituitary has its own set of enzymes controlling the thyroid metabolism that are 1,000 times more efficient than the rest of the body. It has its own unique set of enzymes. So the rest of the body can be suffering greatly with low thyroid, but it doesn't show up on this blood test. We finally know why exactly that the TSH doesn't work. But guess what? They've never published it in any medical endocrinology textbook, and it's been out there for 2 years.
And what about, because there's iodine so intimately related to iodizing tyrosine to make T4, and then gets cleaved, and so is the supplementation of iodine pretty much a given too? You get a supplement?
Well, yeah, the thyroid is made up of the iodine molecules in the tyrosine, and the iodine is in the periodic table chart called halides. The halides are fluorine, bromine, chlorine, iodine, and one other we can't pronounce. So fluoride, if you aren't taking iodine, we're constantly being exposed to fluoride, which, by the way, destroys the thyroid gland slowly but surely over decades. That's in Dr. Jerry Tennett's Healing His Voltage book, and it's also, I think I have it in my latest. Anyway, so yes, you need to be taking iodine. Dr. David Brownstein, who's a friend of mine, has a book, Iodine, Why You Need It, Why You Can't Live Without It. And so if you aren't taking iodine, you're going to have fake thyroid, Dr. Tennant calls it. So instead of having iodine on your thyroid hormones, we have fluorine, chlorine, and bromine. So yes, you need iodine. I caution people when they start taking iodine, they should put it on their skin, see if they tolerate it, because some of the autoimmune Hashimoto's thyroid patients, you can send them into a big tizzy just by using a little dose of iodine. So be cautious if you're treating it.
Okay. We are right here at the gun lap. We are coming around the home stretch with a minute or two left to go, and so I'd like you, as we got bongos in the background. Actually, it's taking care of our sayonara moment here. Tell you what, Dr. Strr, we have come to the end of our show. Thank you so much. You've done what I believed I knew you could do. You've made that connection between heart attacks, heart failure, and diabetes, and how to prevent it. Thanks for the work of Dr. Berta Barnes and your ability to bring us that message. Great work, Doctor. Our paths are going to cross again. Thank you so much for coming aboard this morning.
Thanks for having me. Take care.
Absolutely. Bye now.
Bye.
All right, folks, there you have it. Dr. Mark Strr, I mean, this stuff is information you can't get anyplace else. But, of course, you expect to get it here. I want you to enjoy yourself today. I'll be looking forward to seeing you on Wednesday when Dr. Lee Cowden is going to be my guest. Until then, this is Dr. Dennis Courtney with Dr. Mark Strr saying so long for AIM Impact on Your Health.